We know that 1 in 4 individuals struggle with mental illness and 1 in 5 individuals struggle with addiction. We are all connected, and we know that we have family members, friends, and coworkers that struggle with mental illness or addiction.
In mental health, 2 of the biggest problems we have are matching up a provider with the specialty that a patient needs, and then also getting them the help that they need in a short and timely manner.
If access is tight and you have to wait a long time to see anyone, but you don't know if you need a doctor or a therapist or a coach or a nutritional change or an exercise routine, you might wait for weeks or months to see someone only to be told you're in the wrong line, you need something else.
It started with me in college when I was in class. I was doing really well. I was up all night. I was running, I wasn't eating, so I knew something was wrong. So I went to this doctor at the school, the therapist there actually, and he told me to get a brain scan, so I did, and that came back fine. 15 years later, I had the opposite. I couldn't get out of bed. We had kids, I had a really good life, I was on TV.
Good Monday morning, Ken Barlow here with your forecast for the next couple of days. A nice day today, relatively speaking.
So that went on for 2 weeks. I went back to another doctor. He told me that I had a grass allergy. And then several years later, I had moved to Boston. My family was here. I was flying back and forth all the time, and it caught up with me. I went to a neurologist, and she told me I had vertigo. So 3 misdiagnoses, it's like 3 strikes and you're out. 2 months later, I collapsed. Then I was hospitalized for 2 weeks. My body had just had it. And I was diagnosed with bipolar I disorder and general anxiety disorder. The difference is I decided to break the chain of shame, and I decided to come forward with it.
One of my goals is to go out and make people know that you know somebody who has a mental illness, you just don't know it.
There are a lot of gaps, especially in our outpatient services, where we have clinics that have access that takes about 8 weeks for a new patient to come in to see a psychiatrist.
My daughter was 14 years old at the time. She started to experience some panic and anxiety. As a mental health provider, I just knew that it was really important to get help sooner than later. I looked for help and found out that it was a 4-week wait. And in some cases, I was being told 6 to 8 weeks. It was extremely frustrating and painful to watch as a mother and as a clinician. Eye-opening for me to realize like just what people go through to get their foot in the door.
Individuals are confused in the community as to where do I call? If they don't know where to call for help, I mean, oftentimes we're asked to look at the back of an insurance card and call that number. That may or may not be helpful to us.
One of the experiences that I had was with a father who was calling in trying to find a provider for his son. And I gave him a list of names. He called back a couple days later. Turns out that our list of names was so old that one of the guys had passed away, another one had retired. So I gave him another list of names. And he called back a few days after that, telling me that his son had tried to commit suicide. Maybe if we had had a complete list of names, or an updated list, we wouldn't have had that problem.
Allina Health has one place that if you're struggling with mental illness or addiction, depression, anxiety, that you can call this number no matter where you live within the state, and you will be able to speak to somebody who can screen and assess and make that connection to the right service, whether it's within Allina Health or within the community.
To be able to pick up the phone and call somebody and say, I think something's going on. I feel down, I can't get out of bed. All the things that I was feeling, I wish I had that line, because if I had, I wouldn't have been misdiagnosed my whole life.
At a time when the community is talking about the mental health system being broken, we actually have an opportunity to address the promise we've failed on historically. And that is serving those with mental illness and addiction with the same promise that we serve everyone else.
In mental health and addiction, we don't need a $15 million piece of equipment. We need people. We need professionals, highly trained, who are subspecialized and general, who can provide all sorts of care for our patients and meet them where they need to be met. And that's what we're investing in.
We have a wonderful opportunity to all contribute to this change and lead this transformation.